Googling your symptoms when you're not feeling well, it is something most of us have done.
Now, many patients have switched to asking artificial intelligence for advice on medical care. It's something doctors say can be good and bad. Nikki Clark has more.
You wake up with a sharp pain in your leg. Medicine is not working, and you start to get concerned. Before you take yourself to urgent care, you decide to make sure you're not overreacting, and you plug your symptoms right into an AI chatbot.
One of the things we have to be comfortable with AI. AI is the future. It is what's happening.
Dr. Andrew Godby with St. Francis Healthcare System is seeing more patients who are doing exactly that.
People are interested in their symptoms, they're worried, they're concerned, so that's why they go to these new tools.
They'll usually have printouts with me, they're like, hey, this is what AI told me, and this is what I'm thinking is going on.
Just across town at Mercy Southeast, Dr. Jahan Mergazer is seeing the same thing.
I like those conversations because they've actually they're invested in their care, they want to know what's going on with them, they've taken the time to look it up.
And though I could just ask ChatGPT how reliable its own medical advice is, like these doctors will tell you, the best bet is always to ask your physician directly.
When you're asking it to diagnose, it doesn't know your history, it doesn't know what medications you're on. It can't look at you and say, hey, you look a little sick.
Their biggest concern, however, is looking at AI and thinking it's as good as going to the doctor.
I don't want AI to talk them out of seeking care.
When you're asking AI questions like this, it will usually tell you when you need to seek medical care and encourage you to do so. But you still need to be careful, even if the answer it gives seems right to you.
Sometimes it's difficult to know where it came up with those answers.
There are things these doctors say you should be asking AI.
A lot of patients, after they have their gallbladder out, or after they've been diagnosed with diverticulosis or something like that, they'll ask me what they can and cannot eat.
The bullet points it gives you are actually really beneficial here.
AI does a really good job of summarizing. It will give you bullet points. Eat this, don't eat this, and it's very simple to follow.
When you give it something specific, like this is my diagnosis, what should I expect? The beautiful aspect of AI can explain things in normal terms.
At Mercy Southeast, Dr. Mergazer isn't just talking about AI, he's actually using it himself.
And Miss Nicole Clark is a 26-year-old female who comes in for a chronic care visit. I'm going to just leave it there and it does its thing.
He pulled up my chart and used the software called DAX during our interview. It actually hardly logged anything that we talked about, but as he'll tell you, that's the point.
I tell patients this is just a recording device. It kind of makes my note for me, so it allows me to talk to you in person rather than typing the whole time while you're in the room. And a lot of times in family medicine we talk about family stuff like daughters' weddings and stuff. It removes all that stuff out and it'll actually just kind of keep the medical stuff in the chart. It's very good at that.
So when Dr. Mergazer and I spent the whole time talking about AI, the software knew that information did not need to go into my medical history.
It summarizes the data, so it provides bullet points. And I think the biggest benefit is patients love this because I'm talking to you. I'm not in front of a computer typing the whole time. You get that kind of human connection back by being able to free up my time to not be charting while I'm in the room with you.
Mercy has access to another software called ADOC. If the AI software detects your CT or X-ray has anything out of the ordinary, it flags it.
Before the radiologist even gets the stuff, it's been able to pick up critical strokes, critical pulmonary emboli, which are blood clots in your lungs, stuff that could really are time sensitive and need to be found as fast as possible. That's been able to detect these time critical things much faster.
But despite even using it themselves, the biggest reminder from your doctor is artificial intelligence will never replace them.
And I don't want them to get a false reassurance. I don't want AI to talk them out of seeking care.
In Cape Girardeau, Nikki Clark, Heartland News.
Both doctors say they appreciate their patients being invested in their care and encourage them to ask questions, but of course, never use AI instead of going to see the doctor.